Here he goes. Hi, everyone. I want to thank you today for coming to talk to us about a new partnership that we have. This is going to be amazing. I can't wait to have you hear all about it. We hear consistently that a pain point for everyone is healthcare. Um, we know that the ability to offer a terrific benefit for your employees at a reasonable cost is a significant challenge. And so we want to talk to you about an add-on today with VR Health and Wellness. And we've got Desiree Porter here to meet with you and to explain the benefit. Feel free to jump in at any time if you have questions. You can put in a question in the chat, whatever you want to do. And we'll be sending this recording out to everyone so that they can see and know what we've got to offer you. So without further ado, Desiree, I will let you take the lead and do this.
Thank you, Dawn. Appreciate y'all for letting me share our program with you. This is called Amaze Health, and like Dawn mentioned, this is a employee healthcare solution. And it's one that won't break the bank. It's a way to offer some health benefits for your employees without changing either your major medical, or if you don't offer major medical, now you have some sort of benefit at a very reasonable price. So let's dive on in. And as Dawn mentioned, if you do have any questions, feel free to drop them in the chat. There we go. Okay. All right. So with Amaze Health, we are changing the way healthcare has been used before. So they've got a comprehensive virtual solution. If you have major medical, this does not change your major medical other than reducing your premiums and your claims. If you don't offer major medical, this is a great way to get some competitive benefits available for your employees and yourself. This is complete virtual care for the whole family. So this is app-based. It's available with $0 copays, $0 deductibles. It fills in the gap left by high deductible health plans or any major medical, or as I mentioned, without major medical, this is still comprehensive virtual care. It's available 24/7, 365 days. There is doctors available within 15 minutes of logging on. They are available in over 80 languages. Again, you click on the app, you tell them what you need, you can message, there's text available. You get immediate connection and assessment. This is available with an instant response. So there's no waiting rooms, there's no online forms to fill out, any pre-authorizations. You reach out directly and speak to a doctor. There's a collaborative medical team that's available. All of these are full-time salary W-2 employees, meaning there's no time constraints. You know, when you typically go in to see a doctor or an urgent care, you're waiting. They have limited time available. There's no time constraints for visits. There's unlimited follow-ups. Physicians, psychiatric nurses, benefit experts, as well as patient advocates. This is huge when we're talking about employee benefits. We know how much time off is necessary either for the employee or for their families when there's a health issue. Now we're streamlining this. They feel better quicker. They're able to get back to work sooner. Or if they have a child who's ill, this is available for the whole family. So not just the employee, but their entire family, their dependents up to age 26 can use this same program at a $0 deductible, $0 copay, unlimited use. This goes back into reducing urgent care visits. If you do have major medical, we see a massive reduction in urgent care, not just because you're reducing the monetary cost of utilizing this, but you're also having the convenience of being able to go out to your car, be on a break, reach out to Maze Health, You could do this at home when your child's sitting on the couch. Again, this covers the employee and their immediate family up to age 26. This is unlimited use, $0 copay, $0 deductible. We also have a huge program that helps with mental and behavioral health. This is set up again 24/7. They have immediate connection to a provider. There's 0 intake forms, 0 copays, and unlimited visits. There's 4 tiers. This goes through either peer support, clinical support, psychology, and psychiatric. This is substance abuse treatment, medication management, disorders, anxiety, depression. It's available and it's not limited, either monetarily, financially, or restricted by limited visits. We have seen so much with mental and behavioral health and how the awareness is coming to light, and we're providing resources available. But this kind of completes the picture where there's a process, especially from an employer point of view, when you're able to provide resources that support their mental and behavioral health, and it's unlimited for your employee, for yourself, for your family, and to have those resources with the restrictions removed. Again, we've talked about the virtual primary and urgent care. We've seen this time and time again where it's just, for lack of a better word, amazing. Myself, I just experienced using this last week, actually 2 weeks ago when I was traveling. I rarely get migraines, but I had one and I was out of town. I did not have any migraine medication with me, and I reached out. They were able to see my previous history. They were able to call me in a prescription, and it took me about an hour before I was back ready to go to work again. So I personally have used this for myself, my family. We are big fans. And just imagine what this access does for your own family, your employees. If someone's sick with the flu, now they can go out to their car, get diagnosed, meet with a doctor, get a prescription, an antibiotic, Tamiflu, something called in, go rest, recoup, and get back to work. They feel better, and you minimize the absentee. They have prescription support. We have thousands of prescriptions at a $0 cost or a extremely low cost. We also have virtual dental support. They have virtual ortho and physical therapy support, long-term and ongoing health management. This is huge, whether it's chronic disease management, if it's hormone weight management, all of these are available ongoing. And again, it's at a $0 copay, $0 deductible, unlimited. So you're able to reach out when you need any assistance with your medical or your health. We also have billing advocacy. So if there is a service that you needed that's not available in the system, let's say there's a broken bone, somebody needs to go to the emergency room, you still reach out to Amaze. They help you navigate the system. Okay, let's see what's in network. Let's find the right place for you to go. Let's find the best pricing for MRIs, CT scans, lab work. They're able to help with insurance support, where, if there's errors, they can help fight those billing errors directly on your behalf. All of this is available in the app. Again, they have a massive library full of wellness and health education. Employees, their families love this, whether it's a reduction in prescriptions or just the convenience of reaching out and being familiar with doctors who already know your history. They're familiar with you. You can reach out with, like they said, avoiding having to take off work and take my son out of school for an office visit. And instead, they took care of it in the evening while we sat on the couch. I have a son, it's convenient. Here's how we cut claims to keep them out of the system. A big piece is prevention, then treating and advocating. So it's nice to have somebody on your side that isn't incentivized to promote one thing other than the best health for you. We see predictable savings based off of a reduction in premiums and claims. If you have major medical, by using this as a first line of defense, we typically see over 500,000 saved per year on 200 employees off of their major medical. The savings are found whether it's a reduction in surgery spend, mental health, ER visits, imaging costs, specialists, or urgent care. Again, this gives you the ability to attract and retain the best. We know it's competitive, and when you have benefits, especially at such a great price point, you're allowed to support those employees and give them the edge and the convenience for not just them, but their family as well. Yeah, we also make this really easy for HR. So we can put this in very simply. We remove the HR bottleneck. Now they have one person to call instead of multiple groups. We help manage the multiple interactions, whether it's their major medical. We have one simple platform, and we work directly with whatever other benefits are involved. So we know childcare centers carry a unique challenge. There's tight margins, high staff turnover, and workers who rarely have time to see a doctor. This is a complete virtual health platform that gives your team instant access to real medical providers, no appointments, no waiting rooms, no extra cost. And we've discounted this, especially for ECEA, at $36 per employee per month. It gives you a chance to reduce staff turnover, simplify HR and benefits administration, more uptime, less absenteeism. Also gives you that competitive edge. When we're talking about the benefits for your employees, 24/7 on-demand medical access, no copays, no deductibles, and benefit for the whole family. It's phenomenal. All of these different services, prescription, weight management. We have a great source for those who need GLP-1s, insurance navigation, chronic disease. There's a huge education center, as I mentioned, in the library. We also have an option for a tax strategy. If you have 10 or more full-time employees, you have the option of looking at this tax strategy. It's a fully compliant, federally backed pre-tax plan through the IRS Section 125. It's expanded under the Affordable Care Act, and it's tri-agency approved. It is a triple indemnity accident plan as well as the health and wellness. It gives an employer impact savings of about $550 per employee per year. It increases the employee's take-home pay roughly between $1,000 and $3,000. Again, the program is the same where it's unlimited usage for the entire family with dependents up to age 26. This tax strategy does it through a FICA tax savings. It also does the reduction in major medical by supporting their reduction in claims and premiums. The employee sees an increase in take-home pay, and they also experience the same amaze with the $0 copay, $0 deductible. This is done at a net zero cost plus the additional savings for the employer. So roughly, with 100 employees, that's roughly 55,000 saved annually. And it just goes up from there. It's the same program. The only thing that's added with the tax strategy is a full coverage accident plan that's included. So again, you get to see the virtual healthcare system, the reduction in major medical, and it's very seamless to onboard. Right now, we've got a website set up for ECEAVR.com. And if you have 10 or more full-time employees and you're interested in the tax strategy, click that and you can schedule an appointment where we'll dive in and we can right fit your company to see what the estimated savings would be, how this looks, and how quickly we could onboard if it's the right fit for you. If there's 9 or less full-time employees, or you're just interested in purchasing the Amaze Health for your employees, click that one and that will give you the pricing for Early Childhood Education Association.
See why I couldn't wait to get this in front of you guys? Like, it is such a difference maker. And we really, if you have 10 or more employees, you really need to talk to Desiree one-on-one because she's going to be able to tell you just what kind of savings you can generate from this, because it's moving a cost of a program over into pre-tax dollars. And so now what those large companies nationwide have been able to historically do for the last 40 years, they're making possible for you as a small business to be able to do. And so it's a pretty extraordinary benefit. It's something that is going to put you back in the driver's seat as a business, give you more revenue to be able to work with, and better benefits. And Desiree, you didn't mention the one really interesting point. This is not just available to your employees, but they are also making this available as a benefit, because you're a member of ECA, a benefit for your clients if they want to sign up as well. So your clients can do that for the $36 a month, which is extraordinary to have full coverage for their entire family.
Yes, Dawn, you've nailed it. I was saving that for the second round, but it is true. We want to make this as comprehensive and complete for the centers as possible, where as they manage the child's health care in addition to their well-being, they have access to that with the parents. So we see the support being integrated and aligned.
So this is just another thing where we, as a trade association, are making a benefit available to you that you can also make available to your families. You told us in our recent survey that that was important to you, and so that's happening here. We also have really designated our family fun fair. You're going to get an update about that here later on today, where our family fun fair is for your families to say thank you to them for being in care in your program, and you don't have to pay for it, which is pretty extraordinary. So we're really looking for those creative ways to help you make a difference for your families, and this is the number one way to do that. Does anyone have any questions for Desiree about the product?